Today, on this rather chilly morning, I'm here with neurologist Dr. Nikos Evangelou, who's done some work into temperature sensitivity and multiple sclerosis. Am I right to say that you got a bit of an interest in the subject?
Yes. I have some very competent people and the whole lab on temperature regulations. I collaborate with people in Loughborough University, and of course it's something that in the neurology clinic we hear it all the time. People report the sensitivities to cold, to warm, and so it's an important topic, has not been explored enough.
No. And I think it's an interesting one, because every time we post about it, if we post in the summer to say to people, it's hot, let's try and stay cool, there will always be some people saying, oh, I love the heat, the cold is the horrible thing, and vice versa. Now there's a lot of people who are complaining about the cold, but there's always some people that are popping up and saying, oh, but it's lovely now. So first question, I guess, is what is temperature sensitivity in MS and how does it sort of manifest?
Most of the people, they will find out they concentrate on the hot weather, exactly as you said. Most of the people will concentrate on the hot and sweaty summers. And what a lot of people will report is that they're getting very, very easily tired, and they're getting more symptoms related with the temperature changes. And so the textbooks will describe that people with multiple sclerosis, they are more sensitive to heat, and sometimes they will develop new symptoms. Sometimes some of the symptoms that they have been there, they resurface. You will have a weakness of your right leg and you can function all right, but the weather will become really hot, and then the right leg will start causing problems again. And if anything, this sensitivity to heat is, if you do these questionnaires, and every person that will come to the clinic, you say, what's going on with the temperature, they'll probably 60 to 80% of the people, they'll say, I have been experiencing some problems with the heat, and some of my symptoms are worse. So the hot weather and this is, somebody described it, I don't know, 100 years back, UTOFs, and everybody talks about this UTOFs phenomenon, which means that the symptoms very frequently get worse with the temperature, and that affects, as I said, many people with multiple sclerosis. And even the old days, I'm old, but not that old. People were saying that we didn't have any other tests, we didn't have MRIs, and people were using this hot bath test.
Yes, I remember reading about that.
I mean, this is a bit bizarre, isn't it?
Yeah.
Just put you on a hot bath, and because the weakness will become a bit more, I don't know how accurate, how reliable the test was, and certainly nobody's using it at the moment, but every so often you'll hear people reporting that, oh, look, I'm having my hot bath and my shower, and then it will take me a bit of time to get back. But as we're discussing about the cold weather, and as you were saying earlier on, it is quite cold outside.
Yeah.
There are a number of people that will report exactly the opposite.
Yeah.
And they will say that as soon as it starts getting cold, nothing works. Sort of the symptoms, they become worse. So, very long-winded answer. Yes, 60 or 70 or 80% of the people will say in the hot summer they will have worsening of the symptoms. But there is a problem also with the cold, and probably a smaller proportion, I don't know, probably 5% or 10%, they will say that in the cold weather things are not working very well either.
And are we looking at the sort of same symptoms that would occur in the cold weather as in the hot weather? Interesting,
actually. This has not been looked at. That's very interesting. That's another idea. So the vision, the worsening of the vision is very frequently reported with the hot weather. I have only heard it once been reported in in the cold weather.
Yeah.
It is more weakness, I think, with the cold weather, weakness and aching and stiffness that gets worse. Sometimes people, report the MS hug, the being, the squeezing of your body that is worsening with the cold. Whereas I think, some of we call them the positive symptoms, tingling. I think it's more common to hear it in hot weather.
Yeah.
But actually, I'm now describing my personal experience. So if somebody says to me, "Oh no, that hasn't happened to me," or we haven't done the study, I'll say, "I know."
We were talking about it being a bit colder at the moment, and I suppose it is meant to be getting even colder. Is there any sort of specific temperatures that we should be expecting the people who get affected by cold sensitivity to start feeling anything?
No, I mean, this is the difficulty, and there is, like, life is beautiful with the variation of life, and we celebrate diversity. And similarly, we have diversity with some of the symptoms. And exactly as you were saying, some people with very similar MS, as if you can say that somebody will have a similar type of MS. Some people, they will say that I cannot stand the heat, and others, they say, "What are you talking about? I cannot stand the cold."
Yeah.
So then you can say that, how does this work? How does this work? You have, I don't know, 10 white matter lesions in your brain. You have 10 white matter lesions in your brain. How can you have completely the opposites? And we still do not understand it. So people have, so if you look at the nerve cells, both in the brain and in the what we call in our arms and legs, the peripheral nerves, and you say how fast they send the signal, there seems to be that if they're really cold, they are not sending the signal very fast. If they are normal temperature, we are sending it all right. And if we're getting hot, then there is some impairment of the signal being sent.
Yeah.
And this happens in everybody, irrespective of, this is from young children to whatever. Now, if you have multiple sclerosis, if you have loss of myelin, if the insulation is not working very well, there is also a complete blockage of some of the signals with changes of the temperature. And people have looked tiny little different change of the temperature. Some people have said even a quarter of a degree. A quarter of a degree is, you and me, we cannot perceive it.
Yeah.
But a quarter of a degree will make a difference in the signal, whether it is traveling or not. So, and because there is so much variability, there will be some that they will be in the Sahara and they will say it's okay.
Yeah.
And some with a slight increase of the temperature or a slight decrease of the temperature, they will be affected. So I think it's a bit difficult to say, maintain the temperature of your house at 22 degrees.
Yeah.
Because some people will prefer it and will be more comfortable at 25, and some people, I'm talking about Celsius because I don't do Fahrenheit. And some people, 18 will be absolutely fine. So yes, I think there is a lot of variability, and like we know about many other symptoms, we need to accept it, and common sense should prevail. I mean, that happens in most of the effect of medication. So, people are asking me, how much gabapentin should I take for my pain? Depends on the pain. You start with this, and if things is not, good enough control, just increase the dose a bit. If you find that the side effects are too much, then decrease. So for some of these symptoms, the patient knows their body. Who am I, a doctor or a physiotherapist, to say, oh no, you should stick to that. So I would have said that there is a range of temperatures. Again, I talk a lot in case you haven't noticed. There is a range of temperatures. I think it's important to fit what suits you better. It doesn't matter if the textbook says high temperature or low temperature.
Is it common that people who
It,
are
it is
affected by
common. I mean, it is common. You know, I have come across it, and it depends. Of course, we're talking about the extremes, and I think that people without multiple sclerosis, if they go to Sahara and they go to the north of Sweden, they will report worsening or things. You know, the body is not working very well, and actually. A couple of times studies were done and they have measured the change of the temperature, how it affected both on the warm side, on the extreme, you know, the vision. They have done a number of studies where, you know, they can measure how fast the signal from the eye goes to the brain, and that is affected. But also the opposite, when you get a bit cold, it's also affected compared to the normal, you know, sort of the average range. So you keep hearing of people, you know, reporting more numbness or even bladder symptoms. So, you know, of course, bladder symptoms with a cold, we know there is also other mechanisms that, you know, the kidneys are working in a different way. But a number of these symptoms can get worse both with the warm climate and the cold climate. But then, of course, there are slightly different symptoms. There is something that called allodynia. Allodynia is the sensation. You have one sensation and you feel it as differently.
Oh, okay.
And people, you know, they will say that, oh, there is what is called the touch is a mechanical effect. You know, the touch, I can feel it, and if somebody touches you around, say, I can feel it, and this is allodynia. Now, there is a small proportion of people that you touch, and this is painful.
Yeah.
This is, you know, you're touching me, and, you know, I have a pain, and it happens in a proportion of people. But a significant proportion of people with multiple sclerosis, they have what is called cold allodynia. So something like a third of the people with MS, they will say that touching cold induces pain. If you walk on the snow, you know, it's not very pleasant. And you're, I don't know how many meters can you walk on the snow before you start getting this awkward experience. But a third of the people with multiple sclerosis, if they walk on the snow, they will say this is painful. Some people recommend, if you're trying to get things from the freezer, if you find that it is painful, you know, you can have your gloves there.
Are there any other sort of steps? Because one of the questions that people were saying, how do I actually plan to get through the winter if I'm affected by cold sensitivity?
You know, so some of the concerns, you can go overboard. So when we didn't understand that some people with MS, they have this sensitivity to cold, there was this question, oh, are they dressing up too warm? You know, they were twisting, you know, some people were twisting the argument to say, is it possible because you have been obsessed, you know, with a cold and you don't like it, are you putting so many clothes and you end up yourself so hot that you've gone completely on the other side?
I see.
And you are inflicting. So this is one of the things that you say, that, you know, obviously multiple layers, and again, in Sweden, you know better than me, multiple layers is more effective as opposed to having a huge jumper that you know, might not protect you as much. And the mobility, of course, if you have how many layers of clothing, you know, you would imagine that my movements will be affected. There has been a lot of discussion about the core temperature.
Yeah.
And you know, some of the experiments we did in Loughborough, but also other you know, the scientific literature is not very clear about the cold temperature. So the core temperature is not like, oh, because I put a couple of jumpers, the center of my body, the temperature of my brain is warmer or not. So the body has an enormous flexibility to maintain, you know, a balance in temperature and other parameters that it's not necessarily that all the changes that we're reporting with the temperature is related with the change of the core temperature. And, you know, there are lots of things that we don't fully understand. So, for example, you know, the warming up of the athletes, why do they warm up?
Well, I guess to get your muscles going, and so you're not super stiff when you start.
And you know, but the same applies, but we become super stiff with the cold weather. We know, for example, one of the undisputed spasticity is the stiffness, what the doctors and the physiotherapists call spasticity. The stiffness relates to cold. So if we take people without any neurological disease and you put them in a cold bath, the arms and legs become stiff, possibly because we need to generate, we even start trembling because we need to generate. But this generation means that all the muscles are contracting just to generate some heat. If the muscles are contracting, both what we call the agonist and antagonist. So when I'm flexing my arm, I'm relaxing some, you know, I'm flexing my bicep, but I'm relaxing my triceps. But if I'm in a cold bath, I need to generate heat. I'm contracting both my biceps and my triceps, and my arm becomes stiff.
Yeah.
Now, it is not that extreme, but people with neurological conditions, especially when they have a stiffness of the muscles because of the damage to the brain, they can have this increased spasticity with the temperature. And we don't fully understand this. What I was saying, that there is a lot of debate about the benefits of warming up. And we know that everybody who is an athlete, you know, everybody who does the gym at home and they do their stretching and the exercise, they warm up in the beginning. And we don't fully understand what is the function of this warming up. Exactly as you said, Elena, that, oh, you know, you warm up the muscles, blood goes there and circulates. And if I'll say to you, oh, you just prove it to me, you know, what do you mean? You know, it's something that we almost feel it, but we don't know the microscopic level, the molecular level, because of course, if we fully understand it, then we might, you know, produce some treatments for this, but we haven't got it yet.
That's very interesting, because when I go for a run, even if I'm going out when it's cold, I do tend to do a warm up before inside the house. And when I go out, I don't tend to get that sort of grippy spasticity pain in my leg. But if I go out for a walk, say that I just go up to the shop, or I'll go and pick up my son from school, that's when it tends to happen much more than when I go running. And I guess, again, then the muscle is cold when I go outside.
I mean, this is the kind of things that we could learn, and we can work together with you know, other fields of medicine. So, for example, these the benefits of the warming up. You know, I have no doubt. You know, I have experienced myself. You have experienced yourself that there is a real benefit, but we don't understand exactly. Is it the temperature related, or you know, again, we're talking about warming up. Or is it that, you know, the muscles 2 or 3 times, you know, they need a bit of oiling? Obviously, they don't have oil in the muscles, but the equivalent of oiling. And there are a number of adjustments, you know, metabolic adjustments. You have all these molecules in the muscles that they change, and it needs to happen before, you know, we fully use our legs in running and walking and so on. But still, it's interesting that even for something studied scientifically so much like exercising and warming up, people are still reporting, we don't understand it.
Yeah.
So, you know, I'm using examples like this when, I don't know, in the MS circles, we're complaining, oh, not enough research is being done and we don't understand it. You know, there are lots of things we still do not understand.
This summer, there was a lot of talk about the benefits of really cold showers.
Yes.
You were talking about having a hot bath test. I mean, have there been any research in what happens to people with MS if they do go and have a very cold shower?
I haven't come across. Actually, there are some. You're absolutely right. There was an interest on the cold shower. And as it happens, today I tried it. Every so often I remember it, and there is this idea of but of course, the cold shower, my understanding is, from the sauna, you get the change, and it's more of hormonal, the euphoria, the change of the internal condition that they might give you. But I haven't seen actually in MS. I can imagine if suddenly you have a cold shower and you have a degree of stiffness of the muscles, you will be quite unpleasantly, experience. There are people that they will say, look, I can participate in your research. I'm not exposed to cold. I don't want this bad experience. I mean, this is the difficulty. The cold, and it is not a temperature only. I mean, you can say, what are you talking about? Cold is temperature, but the cold, if you have a cold shower, and they were talking about the surprise bang that hits you suddenly, and this might release a number of other internal chemical cytokines that makes us feel better or worse. People are debating also some of the miserable feeling that we have with winter because the cold is longer. Because our sleep sometimes is disturbed. Can we easily disentangle from the temperature? So if you go from your hot flat and you go out, you can say, oh, it is clear. I can certainly tell the difference that the cold hits me. But when people come along and say, oh, I'm always terrible, my MS is worse in the winter. You don't know, is it the light? Is it the effect this has on our mood? Or is it the coldness on our muscles? And
it's not just one thing, is it, with MS?
It's not one thing. It's not one thing. And it's interesting, as you said about the vitamin D, we know that the vitamin D levels, I don't want to over exaggerate. I think, high levels of vitamin D are very useful for everybody, and for multiple sclerosis, with evidence about increased inflammation. And we know also the vitamin D levels drops in the winter. I think it's a good thing to look at it as a package, and leave it to some crazy scientists to try to disentangle which one is the most important factor. But if you are sensitive to cold, it will be nice to use the common sense wrapping with different clothes and having hot drinks, because trying to keep the core warmer is probably more effective than just putting lots of gloves. But at the same time, don't ignore that there is a normal variation of our mood during the winter and the summer, the seasonal variation. And some people are affected a bit more. And if you are affected a bit more by the dark weather outside and the long nights, that will affect your functioning. That will affect how the legs work. And if your vitamin D is 0 in the winter, that might affect it as well. So it's better almost, I think, to be more holistic and say, okay, we're preparing for the winter. This can go wrong. I mean, there are wonderful things in the winter. We have Christmas, we have Christmas lights. This is jolly things to happen. But
you mentioned briefly sort of bladder problems. I know, growing up in a cold Sweden, we were always told not to sit on the cold, because a lot of people ended up getting sort of bladder infections and things, not MS related, but we know that people with MS are quite prone for bladder infections. Is this sort of sound advice, or is this
no? I think it's the cold. So the exposure of cold. I don't know about bladder infections. Actually, let's think about it. So the kidneys, they have the hormones. We have these hormones in the body, the antidiuretic hormone, that it's affected, and in the cold is secreted less, so we are generating more dilute urine. Of course, that causes us to need to go to the toilet. The more cold we are, the more we need to go to the toilet. Now, if you have also some obstruction of the bladder, you have some, not necessarily obstruction, if the bladder is not working very well because of the MS, because it's a bit more dilated bladder, by having more urine, you expand the bladder. You can, as a secondary, have more infections.
Yeah.
So some people that they might need to use more frequent intermittent catheterization, than would have had in a warm climate. Yes, it's not pure mum's tales or grandmother's tales.
That's good. They're always right, aren't they?
They're always right. They're always right.
So maybe we should end it on listen to your neurologist and listen to your grandmother. Then
I think so. I think that will be. I don't know about listen to the neurologist. Listen to. I think common sense advice that sometimes does take a bit of time to be translated into medical advice. Yeah. It's worth exploring it. It's worth exploring with the MS nurse, but always listen to your grandmother.